40 PANCE Practice Questions Antibiotics with Answers and Explanations Part 4. Hello, welcome to the Science Guide ASAP Learning. Today, we are going to be practicing 40 PANCE style questions. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Question 30. Which of the following is a strategy to prevent the development of antibiotic resistance? A. Prescribing antibiotics for viral infections. B. Using a broad-spectrum antibiotic for all bacterial infections. C. Completing the full course of antibiotics as prescribed. D. Using antibiotics prophylactically in healthy individuals. Answer. C. Completing the full course of antibiotics as prescribed. Explanation. Completing the full course of antibiotics as prescribed helps to ensure that all bacteria causing the infection are eliminated. This reduces the likelihood of antibiotic-resistant strains surviving and proliferating. Prescribing antibiotics for viral infections, using broad-spectrum antibiotics, and using antibiotics prophylactically in healthy individuals can all contribute to the development of antibiotic resistance. Question 31. Which of the following antibiotics is not effective against Pseudomonas aeruginosa? A. Piperacillin, tazobactam. B. Cefepime. C. Imipenem, cytostatin. D. Ciprofloxacin. Answer. D. Ciprofloxacin. Explanation. Pseudomonas aeruginosa is often resistant to fluoroquinolones like ciprofloxacin. Piperacillin, tazobactam, cefepime, and imipenem cytostatin are all effective against Pseudomonas aeruginosa. Question 32. What is the mechanism of action of colistin against Pseudomonas aeruginosa? A. Inhibition of bacterial cell wall synthesis. B. Inhibition of bacterial DNA replication. C. Disruption of bacterial cell membranes. D. Inhibition of bacterial protein synthesis. Answer. C. Disruption of bacterial cell membranes. Explanation. Colistin is a polymyxin antibiotic that disrupts the cell membranes of bacteria like Pseudomonas aeruginosa. Question 33. Which of the following is a potential side effect of using aminoglycoside antibiotics to treat Pseudomonas aeruginosa infections? A. Liver damage. B. Ototoxicity. C. Hemolytic anemia. D. Hypertension. Answer. B. Ototoxicity. Explanation. Aminoglycosides like gentamicin can cause damage to the inner ear, leading to hearing loss and balance problems. Liver damage, hemolytic anemia, and hypertension are not common side effects of aminoglycoside use. Question 34. Which class of antibiotics is typically used as a last resort for treating multi-drug-resistant Pseudomonas aeruginosa infections? A. Aminoglycosides. B. Tetracyclines. C. Carbapenems. D. Macrolides. Answer. C. Carbapenems. Explanation. Carbapenems like imipenem, cytostatin, and meropenem are often reserved for treating severe infections caused by multi-drug-resistant bacteria like Pseudomonas aeruginosa. Aminoglycosides, tetracyclines, and macrolides may be effective against some strains of Pseudomonas aeruginosa but are generally not used as a last resort. Question 35. Which antibiotic class is most commonly associated with Clostridioides difficile infection, CDI? A. Macrolides. B. Tetracyclines. C. Fluoroquinolones. D. Aminoglycosides. Answer. C. Fluoroquinolones. Explanation. Fluoroquinolones are a commonly prescribed class of antibiotics that can cause disruption of normal gut flora, leading to an overgrowth of Clostridioides difficile bacteria and subsequent CDI. It is important to use caution when prescribing fluoroquinolones, especially in patients with a history of CDI. Question 36. Which antibiotic class is known for causing irreversible hearing loss? A. Aminoglycosides. B. Tetracyclines. C. Cephalosporins. D. Carbapenems. Answer. Aminoglycosides. Explanation. Aminoglycosides are a class of antibiotics that can cause damage to the inner ear, leading to irreversible hearing loss. This risk is increased with higher doses, longer durations of therapy, and in patients with pre-existing hearing problems. Question 37. Which antibiotic class is associated with an increased risk of tendinitis and tendon rupture? A. Macrolides. B. Tetracyclines. C. Fluoroquinolones. D. Cephalosporins. Answer. C. Fluoroquinolones. Explanation. Fluoroquinolones have been associated with an increased risk of tendinitis and tendon rupture, particularly in elderly patients and those taking corticosteroids. This risk is thought to be due to the antibiotic's effect on collagen synthesis. Question 38. Which antibiotic class is known for causing pseudomembranous colitis? A. Aminoglycosides. B. Tetracyclines. C. Cephalosporins. D. Macrolides. Answer. D. Macrolides. Explanation. Macrolides, such as erythromycin and azithromycin, are associated with an increased risk of pseudomembranous colitis, a severe and potentially life-threatening inflammation of the colon caused by C. difficile. As with fluoroquinolones, caution should be used when prescribing macrolides, especially in patients with a history of CDI. Question 39. A 55-year-old male with a history of chronic obstructive pulmonary disease, COPD, presents to the emergency room with a severe exacerbation of his symptoms. A sputum culture is obtained which grows Pseudomonas aeruginosa. Which of the following antibiotics would be most appropriate to treat this patient's infection? A. Penicillin GB. Azithromycin C. Cefepime D. Clindamycin. Answer, C. Cefepime. Explanation. Pseudomonas aeruginosa is known to be resistant to many antibiotics, including penicillin G and azithromycin. Cefepime is a fourth-generation cephalosporin with good activity against Pseudomonas aeruginosa and is often used as a first-line agent for treating infections caused by this organism. Clindamycin does not have reliable activity against Pseudomonas aeruginosa. Question 40. A 28-year-old female presents with a fever and a sore throat. She is diagnosed with streptococcal pharyngitis and prescribed penicillin. 3 days later, she develops a rash all over her body. Which of the following is the most likely cause of this rash? A. An allergic reaction to penicillin. B. Stevens-Johnson syndrome. C. Toxic epidermal necrolysis. D. Kawasaki disease. Answer, A. An allergic reaction to penicillin. Explanation. Penicillin is known to cause allergic reactions in some individuals, including rashes. However, these reactions are usually mild and self-limited. Stevens-Johnson syndrome and toxic epidermal necrolysis are severe and potentially life-threatening skin reactions that can be caused by a variety of medications, but are less commonly associated with penicillin. Kawasaki disease is a rare condition that can cause fever and a rash, but is not associated with penicillin use. Please like and subscribe for more videos like this. Comment below for suggestions. Thank you for watching.